Good afternoon. Thank you for joining us this afternoon for this webinar presentation. We just ask that if you are not participating, that you just keep yourselves on mute. And if for any reason you need to communicate with me, I'm coming up as IAMHP admin or IAMHP organizer. My name is Judith Ruiz Branch. I'm the Director of External Affairs here at IAMHP, so feel free to chat me directly with any technical issues or any questions you should have throughout the webinar. We have Jill Hayden from Sellers Dorsey this afternoon to present to us on the policy landscape, and that will encompass past, present, future, and she will explain a little bit more about that. So I will turn it over to her, and if you have any questions, feel free to hang on to them. We're taking questions at the end of the presentation. So go ahead, Jill.
Thanks, Judith. Good afternoon, everyone. As Judith mentioned, my name is Jill Hayden. I'm a director at Sellers Dorsey, and I work with the Illinois Association of Medicaid Health Plans on basically all things related to Medicaid policy. So as we find ourselves here at the end of 2021, which is hard to believe, we thought we would do sort of a review of the major initiatives and policies that the state has undergone in 2021 related to Medicaid. So just to get us started, and just to mention, I will say, as Judith mentioned, I'm going to hold questions till the end just to make sure that we get through the material, but there should be time at the end if you want to ask me any questions. Okay. So I think, everyone knows sort of what the theme of Medicaid has been over the last year, not just here in the state of Illinois, but nationwide. But here in Illinois, I did pull the definition that HFS has posted on its website. And that you can see here is that everyone has a fair and just opportunity to attain their optimal health, regardless of race, ethnicity, disability, gender identity, sexual orientation, socioeconomic status, geography, or any other social barrier or factor. And I swear I'm not going to read all the slides to you, but I think this is probably the most important one and really will set the tone for the initiatives that we review throughout the presentation. So one of the biggest initiatives that we've seen, sorry, my slide, there we go, from HFS in 2021 was setting a new comprehensive quality strategy for the Medicaid managed care program for the Health Choice Illinois plans. They established a vision for improvement and program goals that they set out in 5 pillars, which you can see here, which include improving maternal and infant health outcomes, behavioral health for both adults and children, increasing preventive care screenings with that focus on equity and disparities, and serving more people in the settings of their choice. This last one is really to try to focus on both keeping people out of institutions and getting individuals back into the community who are currently in a nursing home or other institution if they so choose and have the ability to do so. And so in order for, and first of all, I mentioned that in each one of these pillars, there are a number of quality metrics associated with each one of these. You can find these on the HFS website, but there are things like, follow-up after hospitalization, well child visits, screenings, those types of things are basically housed within each of these, and they may be setting baselines and reporting metrics, or they may be pay for performance, again, in the managed care program. And in order to meet those goals, the department has undergone some administrative changes to help the plans achieve those. The first being this admission, discharge, and transfer technology platform, or ADT. Illinois has been trying to implement this program for a number of years, and this year, hopefully by the end of this year, they will have all of the hospitals who participate in the Medicaid program onboarded, along with a number of nursing homes who will be responsible for initiating in real time any admission, discharge, or transfer of a Medicaid client within their facility or out of their facility. And that real-time data will go to the managed care plans and eventually to community-based providers, such as PCPs and behavioral health providers, to let them know that, what's happening with their patient. And as you can imagine, having this data in real time will give the plans a better opportunity to really make a difference and start that care coordination or discharge planning or whatever the case may be, again, by having it in real time. In addition to that, the state also, if you don't know, has a Medicaid advisory committee. It meets quarterly and has for a number of years. It's made up of providers and other Medicaid stakeholders in the department. And then under that, which we call the MAC, under that is a number of subcommittees. And this year, the state initiated a new Medicaid Advisory Committee subcommittee called Community Integration that will specifically focus on that pillar above, serving more people in the settings of their choice, to really look at the state's programs, their home and community-based waiver programs, nursing homes, and really trying to look at how the state can improve their goals around making sure that people live in the community to the best of their ability and at their choice. And then along with that is a revamped health equity and quality subcommittee, again, really focusing on equity, but also focusing on quality at the same time. They actually met this morning, and the plans went through a lot of updates that they have associated with those 5 pillars above, giving an update on each one of those and how they're serving your community and how they're doing that individually. All right. Along with the quality initiatives, probably one of the major initiatives that HFS has undergone in 2021 is the Healthcare Transformation Initiative. So again, you'll see this definition: a person-centered, integrated, equitable, and thorough or dramatic change in the delivery of healthcare at a community level. The department, in cooperation with the General Assembly and the hospitals, we're able to secure $150 million per fiscal year to basically fund healthcare transformation collaboratives. And these collaboratives are made up of providers and other stakeholders in specific communities throughout the state of Illinois, with the purpose of reducing disparities and improving health equity for whatever the particular needs have been identified in those particular communities. There's no, set formula. There's things that the department wants to see, but they're really leaving it up to the communities themselves to put these collaboratives together to answer whatever issues their community is having. The first round of funding was announced back in June. There were 9 initial awardees. I believe there were 1 or 2 that were announced after that, associated with the June 30th date. And those they hope to have implemented in January or early 2022. And then round 2 was announced, I believe, in September. Those applications were due November 19th, and those are pending HFS review right now. In fact, yesterday they announced that the public comment period for those applications are due December 20th. So if you want to go check out, what is being proposed for this next round, you are free to do that on the website there, htc.illinois.gov, and would encourage you to do that if you're thinking about applying for future funding. To support these initiatives, they worked with the UIC School of Social Work for data and community needs reports. And I just wanted to mention that in each of these proposals, it must include those goals that we talked about previously in the comprehensive quality strategy as well. All right. So another major initiative has been around nursing home rate reform. HFS has been meeting with legislators and the nursing home industry for many months now on this issue. I think one of the things that COVID definitely brought to light was, the health inequities and disparities in certain communities, definitely in the nursing home industry, definitely among ethnic and minority populations. And the department has been very vocal on the need for change around this industry. So they were hoping for legislation last year. They were told to go back, write up a report and some recommendations and submit that to the General Assembly, which they did on September 30th. Below, you can see some recommended next steps there around payment and transparency and quality, and I'm not going to read each one of these, but you can read them for yourselves and basically expect to go back to the General Assembly during the spring session and work on some legislation to hopefully get passed this spring. So more work to come on that one. All right, and then finally, again, another major initiative for the department is the Pathways to Success program. So Pathways to Success was born out of the NB consent decree. And just as a reminder, NB was a court case that was filed, I think, back in 2011 that basically said, you know, children under EPSDT who are diagnosed with a mental health illness really don't have access to services in the community. And so HFS has been working with the courts since then, and in 2019, an implementation plan was approved, and the department has been working on rolling that out. As you'll recall, the initial thought is that they would cover these children under the integrated health homes model, which is authorized under the Affordable Care Act. And then at some point, the decision was made that instead of going the integrated health home path, they would use a 1915I state plan amendment, which is specific to home and community-based services. So HFS has filed that state plan amendment with CMS. It is pending approval. They are confident that they will get approval. However, again, still pending, but they are full steam ahead on working on implementation and hope to have it implemented by spring of 2022. So basically what Pathways will do is offer a number of new services in the Medicaid program specific to the NB class of kids who have a mental health diagnosis, who need intensive services, and again, would be eligible to receive these services listed here. The first being care coordination and support in the form of either high fidelity wraparound or intensive care coordination, depending on the specific diagnosis and need of the child and the family. These services would be provided by a new provider type called a CCSO, Care Coordination Support Organization. In order to qualify as a CCSO, you must be a community mental health center or a behavioral health clinic. And they actually released a request for application a couple months ago for organizations seeking to become a CCSO to provide services to this group of kids. And basically what a CCSO would do would be an extra level of care coordination in addition to their managed care organization to ensure that the child and the family and whoever their caregiver is have real access to these services in the community. So in addition to care coordination and support, they would also be eligible for family peer support, respite, therapeutic mentoring, intensive home-based services, and individual and therapeutic support services. Again, you must be a CMHC or a BHC in order to provide these services and in the NB class to receive them. In addition to that, I just wanted to mention that, so under the current SAS program, there's what's called local area networks or LANs, where calls that come in for any adult or child enrolled in the Medicaid program who is in crisis, a call comes into what's called the CARES line and then gets dispatched to the appropriate LAN to ensure that mobile crisis response services are provided to that individual for whatever their particular need is based on the region that they're in. Today, that LAN system has over 60 different regions with a lead agency in each of those regions. And when they issued the request for application for the CCSOs, they changed the LANs to what's called designated service areas or DSAs. So they're reducing the areas down from 60 plus down to 18. And if you're going to be a CCSO, you also have to be the lead organization for crisis response in those regions. So I just wanted to mention that as well, because that's a major shift in the way that those services are provided today. Not in the way, but in the areas that they're provided today. So in addition to the Pathways program, there's a number of other behavioral health initiatives underway in Illinois. The first one is not specific to Medicaid, but will have an impact on the Medicaid program and Medicaid providers. And that's the National 988 Crisis Line. So the National 988 Crisis Line is a federal nationwide initiative. It is overseen by the Substance Abuse and Mental Health Services Administration, known as SAMHSA, at the federal level, and then being implemented here in Illinois by the Illinois Department of Human Services Division of Mental Health, which we often refer to as DMH. 988 is supposed to be designed very similarly to 911, but will be specific to behavioral health crises to ensure that the appropriate providers and services are dispatched for whatever particular issue that an individual is having, regardless of their insurance status. So it doesn't matter if you have commercial insurance or you're uninsured or you're in Medicaid. 988 is supposed to act like 911 in terms of the services that are provided. So DMH has been working for quite some time on getting this program up and running. It is supposed to be up by July of 2022. And there's been a number of work groups that are already working on what it's going to look like here in the state of Illinois. They've submitted their draft to SAMHSA or their contractor, their first draft for approval, and we'll continue on working with SAMHSA on getting that approved. One of the things that DMH did a few months ago, back in the spring, was initiate a funding opportunity for community mental health centers to apply for funding to provide those crisis response services for calls coming into the 988 line. And in that application process, the CMHCs were able to basically say, I would like to cover this region of the state, and DMH ensured that there's statewide coverage. But I wanted to mention it because the regions that CMHCs may be covering under 988 do not match up with the regions under the new DSAs on the Medicaid side. So you'll have calls coming into 988 that may have to go to the CARES line and then go to the appropriate CCSO for dispatch under Medicaid. And it could potentially get a little bit confusing on what calls are going where and who's responding to them in the future. So I just wanted to mention that there's a lot of conversation and discussion among stakeholders right now on getting a better understanding of what that's going to look like. So that's 988. In addition to that, like every industry right now, behavioral health workforce is really struggling. The state recognizes that. They recognize, that there's a need to shore up the safety net here around behavioral health, especially with the rollout of some of these major initiatives. So there's some funding that's been proposed specific to Pathways to, around training and getting providers up and running for those new services, as well as some funding specific to underserved communities around behavioral health. In addition to that, DMH is working with the Illinois Student Assistance Commission on some new loan repayment programs to attract behavioral health providers to the state of Illinois and hopefully keep them here for some time. And then in the Illinois Legislative Black Caucus pillar, healthcare pillar that was passed last winter, I believe, there's a new workforce and education center that is specific to behavioral health. This is more of a long-term goal, but it really is to start attracting, training new providers here in the state of Illinois to focus on behavioral health. It's been determined that the University of Illinois and Southern Illinois University will be the hubs for these training programs, and there will be a number of spoke agencies throughout the state of Illinois that will focus on behavioral health. In addition to that, there are some new individual practitioners who have been authorized to provide Medicaid services in Illinois. Licensed clinical professional counselors, LCPCs, and licensed marriage and family therapists are officially approved and can begin enrolling and billing December 1st. And then veteran support specialists, which I believe are specific to alcohol and substance abuse counseling, I believe those are still pending federal approval. And then finally, if you know anything about Illinois behavioral health, you know that a new assessment tool was implemented some time ago called IAMHP, which has caused some concerns among the provider community, mostly around administrative and operational concerns. And recently, HFS initiated a work group specific to IAMHP to work with the providers on ironing out some of those kinks, especially in preparation for pathways, to ensure that the providers can use that effectively to ensure the success of that program. All right, so let's switch gears to home and community-based services. Again, a big focus nationwide, but also here in the state of Illinois. It goes back to that quality pillar to ensure that people are living in the community as long as possible, you know, for those who wish to. Like other states, Illinois took advantage of the Appendix K emergency flexibility. So Appendix K is available to states during an emergency. It is not specific to COVID or the pandemic. It's available, you know, in weather events like hurricanes and things like that. The states have used this, but it allows their states to have some flexibility in their home and community-based waiver programs. You know, for COVID, it was things like face-to-face visits and training and licensing and home-delivered meals, and just making sure that people who are social distancing in their homes stay safe, and give the states some flexibility on you know, some of those requirements that are in their waiver programs. In addition to that, the American Rescue Plan Act, which is a federal legislation, allowed for a 10% federal match for the state's Medicaid programs for their home and community-based waivers from April 1st of 21 through March 31st of 22. Illinois did submit a pretty comprehensive plan, and they got partial approval in September of 2021, but to my knowledge, they're still waiting on full approval there. There was a lot of initiatives around home and community-based workforce, around training, recruitment, and retention, allowing parents as caregivers, lots of tools and technology flexibilities and expansions, home modification, and expansions of additional services that can be funded with that additional FMAP. But again, pending full approval there. Some other programs for older adults in 2021 included an expansion of the Medicare-Medicaid Alignment Initiative. So MMAI is a three-way contract between federal CMS, HFS, and the Medicaid managed care plans here in Illinois. It covers individuals who are eligible for both Medicare and Medicaid, which we call duals. And it is supposed to be a seamless approach to delivering those services. So for both providers and enrollees, I should mention. So, you know, whether your provider or the services that you're getting fall in Medicare or Medicaid, you know, you're really only covered by that one MCO rather than it being bifurcated between Medicare and Medicaid. This program had been in Illinois since about 2013, 2014, when we rolled out Medicaid managed care initially, but it only existed in certain communities throughout the state. So in July, they got federal approval to go statewide in all 102 counties. The enrollment process is still underway for that. The last cohort is supposed to roll out February 1st of 2022. In addition to that, there's a new program here in Illinois that's been approved. It's called the Program of All-Inclusive Care for the Elderly, or PACE. A number of other states already have this program, but it would be new to the state of Illinois. And again, it is for the duals population for both individuals who are eligible for both Medicare and Medicaid, and those who qualify for nursing home but are able to and willing and wanting to live in the community. They just recently released an RFA in November. In fact, yesterday they released an updated Q&A associated with the RFA, and HFS intends to announce those awards in spring of 2022 with an effective date of July of 2023, and would be another sort of care coordination option for duals here in the state of Illinois. In addition to that, so last December of 2020, the state rolled out a Medicaid-like program for immigrant seniors 65 and older. It includes the full Medicaid benefit package, except for nursing homes and home community-based services, and obviously doesn't include the federal match. And then this year, they got legislative approval to expand that to immigrant seniors 55 and older, and we expect that to be implemented in spring of 2022. Oh, and I would mention the 65 plus program, I believe, has about 8,000 or 9,000 enrollees today. All right, so in addition to those programs, this is a list of new provider types, services, and programs we've seen in 2021 or coming in 2022. So Illinois was the first state to get approval for postpartum coverage for up to 12 months. We did that through an 1115 waiver, and since then there's been federal legislation that's actually allowed that for all states, and so I would expect Illinois to probably roll over to a state plan amendment at some point for this, but as of now, I believe we're still on the 1115 waiver, ensuring that new moms have access to those services. In addition to that, a couple diabetes programs rolled out in August, the diabetes prevention program for individuals who have been diagnosed with pre-diabetes and those who have already been diagnosed, diabetes self-management and education support. Adaptive behavioral health services for kids with autism. Originally, this was rolled out in October of 2020, but the provider types who were eligible to provide these services was pretty limited, and the uptake was pretty limited as well. And so in October of 2021, they expanded the types of providers who were eligible to provide those services. And so we would expect to see more providers coming online as a result of that. Adult chiropractic is being reinstated in December of 2021. Community health workers, doulas, and home visiting program. There was actually at the MAC Quality and Equity Subcommittee that I mentioned earlier, there was a meeting this morning where they took public feedback on these programs. HFS is preparing to submit a state plan amendment for these new provider types, and so they're looking for some comments. The deadline, I believe, is December 31st to submit those comments on what this program would look like, from everything from provider qualifications to services provided to rates, to rate structure, et cetera. So encourage you to check that out if you have an interest in that program. Pediatric palliative care was approved, but again, pending CMS, actually pending SPA submission and CMS approval. There's a new family planning program that's going to be rolled out next year. This would provide family planning services and supports for both men and women, and is pending CMS approval through a state plan amendment with an estimated go live of December of 2022. There was an opioid overdose expert program that was included in legislation last year, again, pending CMS approval, but would cover individuals who present in the emergency department with an opioid overdose to ensure that they get some intervention and then referral to treatment after their ED visit. And then pharmacist birth control dispensing that would allow pharmacists to dispense birth control within the pharmacy. This requires significant training program, will require CMS approval, and I want to say this one doesn't take effect in Illinois, at least in Medicaid, until 2023. And I apologize, I failed to put the date there, so I'll have to double check that one. All right. Along with that, there were some administrative changes in legislation this year, one of which is ambulance carve out from managed care. So ambulance services will now be billed directly to the department under fee for service rather than being billed to the managed care organizations. There's some prior authorization reforms coming in January of 2022. Some medical necessity reforms around behavioral health, but those don't take effect until 2023. Health plan recoupments, which reduces the time from 18 to 12 months that a health plan can recoup payments from providers, and that one does take effect in January 2022. There was language, again, in the Illinois Legislative Black Caucus healthcare pillar legislation around a new medical technical assistance center. This is really meant for, providers who would like to participate in Medicaid and really aren't sure how to get started, just need a little more assistance in the ability of the state to create some capacity there for all kinds of provider types. And that one has yet to get off the ground. So we're watching that one as well. In terms of administrative changes, the department got authorization to move some of the CHIP kids into the Medicaid program, which would eliminate some of the cost sharing of parents. It would make them eligible for non-emergency transportation and would allow many of them to enroll in managed care, which they were not allowed under the CHIP program based on their income to do previously. And then the good news under administrative changes is that the state Medicaid payment cycles are way down. It can be anywhere from 0 to 30 days, which is great news and a long time coming. I think the health plans have sort of shielded providers from some of the pain associated with the delays over the past few years because they've continued to pay on time for the most part. But this is good news for everyone that those payment cycles are down. All right, some of the provider rate updates that we've seen or will be seeing. So there were a number of home and community-based provider rate updates included in that 10% FMAP proposal I mentioned earlier that's still pending CMS approval. So we're watching for that. FQHC's got a little bump last year in addition to their normal annual rate update, encounter rate update. I believe that was to help shore up some of the COVID issues. Dental will see an increase in January of 2022. And then the health kids vaccines will see an administrative vaccine administration rate update in January 2022 to make them more competitive with Medicare and commercial, I believe. And then on the hospital side, there was some language around the safety net psychiatric inpatient rates to make sure that they're getting a minimum there, which is retro. Actually, it's $630, which was retro back to January of 2021. And then there was the SMART Act reduction removal for hospitals that was effective in July of 2021. All right. So public health emergency and federal updates. So just briefly on COVID, just wanted to make sure you all were aware that currently HFS COVID vaccine fee schedule is being reimbursed at the Medicare rate. So, that was pretty easy for the state to implement. They did add the children 5 to 11 were added October 29th per CDC guidance. However, Illinois did add an additional counseling fee for providers onto that because of the extra time and education it is taking between providers and talking to parents about the vaccine for children. And then Illinois has an uninsured provider reimbursement portal just to make sure that for providers to apply to ensure that the uninsured and no one is getting charged for COVID vaccines or COVID treatment in the state of Illinois. And then one of the things that HFS is very aware of and working on constantly is the, when will we start winding down from the public health emergency? The biggest impact is obviously going to be on enrollment and eligibility. So since the beginning of the public health emergency, states have not been able to remove anyone from the Medicaid rolls, which they normally would do through the redetermination process as their annual anniversary comes up. In the state of Illinois, they are able to do a number of redeterminations through what's called an ex parte process, where they can electronically verify that someone is still eligible for Medicaid services or Medicaid eligibility. And so they're doing those as much as possible and updating their anniversary dates as they go. But there's about 60% of the population, I believe, that's going to require mailing out forms and having individuals verify that the information is still correct. And obviously this brings a lot of concern associated with, do we have the right contact information, addresses, emails phone numbers, et cetera. And so HFS is in the process of developing an outreach campaign, in anticipation of the end of the public health emergency. Right now, states have at least 60 days notice from the feds to get prepared for this. I know the states are lobbying to get at least 90 days, so we'll see what happens there. And right now they have 12 months to comply. Illinois has stated that they're going to take all 12 months to do that, but that potentially could be changed. So the other sort of wind down issues come around the Medicaid flexibilities. Again, back to Appendix K, they'll have to wind down some of those flexibilities they got in their waiver programs. If they got any under that are still applicable under the 1135 waivers, that is an option for states, just to waive some of those requirements during the public health emergency. And then things like telehealth. In Illinois specifically, telehealth, got legislative action last year. There were mandates in there for the commercial industry, but it really was permissive when it came to Medicaid, and allowed the department to work with stakeholders to determine what telehealth flexibilities would continue past the public health emergency. I know that they're interested in being as broad as possible, but they are actively taking provider stakeholder input on what telehealth should look like after the public health emergency. And then all of this could be impacted by congressional action. They're currently negotiating the Build Back Better plan, and there has been language that's been included so far around the public health wind down. The redetermination timeline could be included in that, and then along with that, during the public health emergency, the states are getting a 6% increase in their federal matching funds for Medicaid. That will be phased out, and we don't know exactly what that's going to look like yet. But it will, obviously have a financial impact on the state. But there's also provisions in there around states and the Affordable Care Act expansion population to encourage states who have not already expanded their Medicaid programs to the ACA population to encourage them to do so. And so there's been discussion about, well, what does that mean for states that already have? As you know, Illinois did this quite some time ago. And so one of the things that they're considering is changing the 90% match floor from the feds to something like a 92.5%, just to not only reward states that have already expanded, but also help sort of ease that burden of the 6% phase out. So, we don't know exactly when that's going to be finalized, but obviously going to have a huge impact on state Medicaid programs as well. So that brings me to the end of my presentation, and I would say I'm sure that I did not get them all. I tried to get the high level changes over the last year, and at this point, I think I am ready to take any questions if you have any.
Thanks, Jill. Let's see. If you could raise your hand if you have a question, and then I can unmute you, or you can put your question in the chat or just say, I have a question. Or I'm happy to try and unmute the participants. Let's see. Jill, I think you were very thorough, and so maybe there are no questions. Jill, can you talk now?
There we go. Yes, I was trying to talk. No one has any questions?
Yeah, that's pretty surprising. All right, well, if you guys do go back and just digest the information and think of some questions, you can feel free to reach out to myself or Jill. Her information is on the screen right now, and then we will be providing, of course, IAMHP's information, contact information. If you don't already have it, I'm sure all of you do, but just in case you don't, and a follow-up email. And yes, Emily is asking Jill if the slides will be shared after.
Sure, yeah.
Okay.
And I can update it with some links to some of these specific policy initiatives so that you can just click on that and go straight to it.
Perfect. Okay. So yeah, I think that was the only question. And so yeah, so just be looking out for a post-webinar email from IAMHP. And like Jill said, it will include updated links as well as the slides. So if you go through them and you see that you have any questions afterwards, feel free to reach out to either one of us. But thank you so much, Jill. That was very informative, and we really appreciate your time this afternoon. And we thank you guys for joining us this afternoon. And we are so close to the holiday season into next year. So if we don't speak with you before then, everyone here at IAMHP would like to wish you guys a very Merry Christmas, Happy Holidays, whatever you celebrate, and a Happy New Year. And we look forward to the work that we will continue to do in 2022.
Thanks, Judith.
Thank you, guys.